Welcome to Legacy Magazine Presents Black Health, a weekly talk show discussing medical issues afflicting and impacting the Black community. Now introducing our host, Dr. Michelle Kirwan Blythewood.
Good afternoon and welcome to Black Health. I am Dr. Michelle Kirwan Blythewood and I am the host of Black Health. I'm also a board certified pediatrician and the chief medical officer of a federally qualified health center in Miami Gardens called the Pediatric and Family Health and Wellness Center. And I am pleased to have with us today two amazing dentists in our community, Dr. Kyle Fernard and Dr. Kevin Fernard.
Hello, hello.
Welcome. Thank you for joining us today.
Thank you for having us. Thank you so much.
Absolutely. I'm going to first ask you all to introduce yourselves to the audience. So Dr. Kyle, why don't you go first?
Okay, I'm Dr. Kyle Fernard, born and raised in Miami. I went to undergrad and did my schooling in Washington, D.C., Catholic University, where I played college basketball for 4 years and then attended University of Florida for dental school, the same dental school as my dad did in 1987. So it's a blessing to continue that legacy.
And then, so obviously we're twins, but very, very similar upbringing. Born and raised in South Florida, loved a bunch of sports, spending time with the family. And then same path as Kyle, did 4 years at Catholic U where we played basketball. And then also graduated from UF College of Dentistry in 2020, continued our father's legacy.
Awesome. And I hear you all had an amazing pediatrician when you were younger. Do you remember?
Yeah, so it's funny.
Dr.
Cohen has been our pediatrician for over 20 years. We kept seeing you, I think, till we were 20, right?
Yeah, 2021, somewhere in there, until you went off to college, probably. So It's amazing to see you all as accomplished young dentists now. So growing up, I always knew that you had an amazing future ahead of you. And actually, your father is a dentist. So what inspired you all to follow in his footsteps?
Always just growing up, we always wanted to do something in the health field, whether it was medicine or pre-dental. We kind of didn't really know and pick a track until our freshman year of college. But actually it's funny, patients and people always ask us, did our father always push us? And, our parents aren't the type to push us to do anything. They just want us to do whatever we do 110%. But it's amazing to see once we, enter our second year of college where we had to do shadowing hours and to see the stuff and the impact that he had on the community, especially the underserved community, because all our practices are in certain areas of Miami. My brother and I looked at each other and were like, yeah, this is exactly what we want to continue and help.
And for Kyle and I, it was definitely going to be, whatever we decided to do, it was always going to be the same career, the same path. So it wasn't,
roommates in college.
Yeah, we were roommates in college, roommates in dental school. We're still roommates now. That's changing soon, but we knew it was wondering.
I was wondering if you all planned to go into the same field, because you all always have been very tight since I've known you as children. You've been very close and very tight. So I had asked myself that. Kyle, you mentioned that you have several practices now. Is that correct?
Yes. So right now we have 4 practices, North Miami, Little Haiti, Miami, downtown Miami, and then one in Sunrise area. So my dad's trying to expand towards the Broward area. And he's kind of more, leaning towards doing the management side of dentistry versus the actual clinical, the actual practice side. So he wants to manage more offices in certain areas and expand that way because he has, us to kind of work. My fiance is also a dentist, so it's good.
Yeah. Well, congratulations to you all and your father. I had no idea that you had 4 practices now. I've always known the one on 119th.
Yeah.
So awesome. So giving back to your community is very important to your practice. Why is that the case?
Yeah, it's just how we were raised. Our parents come from very humble beginnings. Our father's from Haiti, and he migrated to the U.S. when he was 8 or 9 years old, and very humble beginnings. And it was always important to him because of the lack of access to care when he arrived to the U.S. So came with our family and not with a lot of money. So for him, he had a toothache as a child. He had to go to someone's garage just to be treated. He couldn't even go to a dental practice. So he always told us that moment he knew he was going to come back and serve in his community. And then that just affected us. We were always raised to be humble, treat people with respect no matter what. So for us, it was simple.
Yeah, and it's kind of funny to look at, but not even just Haiti, but in America, our backyard, the lack of, you know, the lack of service that our community has in terms of the underrepresented community it's amazing when you go out, because it's not, you don't see like the care that they deserve to get. And it's in North Miami area, but we practice in North Miami, but if you go across the tracks in Aventura, there's a ton of dentists. But where we're located, there's not, people don't want to come out of dental school and come practice where we do. So we look at that as an opportunity to give back and, to be the dentist for our people in a way.
Yeah, that we have a lot in common with that. My dad is a physician surgeon, also from humble beginnings, also one to give back to the community. And I followed in his footsteps, also not pressured either, but followed in his footsteps. And now I'm in a similar, I'm in the community, Miami Gardens, Opelika, predominantly community. And I absolutely love, working and giving back to this population. So I'm going to switch gears a little bit. During the height of the COVID pandemic, was your practice impacted, and how so if it was?
Yeah, for sure. We actually closed a couple days a week, but what we did is we stayed open only for emergencies. So the goal was to keep patients out of the ER who had dental toothaches or some type of intraoral infection, that we can still see them and treat them, just to keep ER specifically for COVID patients. We did a bunch of different protocols. We, installed air filters in the ACs, everything like that. So
yeah, it was a scary moment for everybody. Patients didn't know, what to expect, just like the whole world. But we were open for like only emergency cases for about like 2 to 3 months. And then we started, slowly opening for elective treatments. Patients wanted to get fillings, cleanings slowly. But, we followed all the protocols, the 6 feet apart. Everything was wiped down, sanitized. So we had to follow all those protocols. But it did have an impact, like everyone else, on the practice, of course.
Yeah, we did similarly to what you all did. We did emergencies only. And, people talk about how we were on the front lines as physicians, but I imagine it must have been a little daunting being on the front line as a dentist, because you're actually in people's mouths, and the best transmission mode for COVID is droplets. So I'm sure that was difficult and a little hard to finagle, and probably also scary for patients to be sitting with their mouth wide open as well.
Yeah, and also, we have an amazing staff. We have to give a big shout out to our staff, because, we can go in and work, and you, just as you know, Doc, that we can't operate without our front desk, without our assistants. And there's some of the bravest people also. They stuck with us through uncertainty. So
up and downs.
Yeah, we have an amazing staff, amazing staff.
From a dental perspective, are there any side effects, like dental side effects, from anyone that has contracted COVID that you know of, or that you've seen?
Yeah, as far as specifically, I would say mainly probably a little more inflammation of the gingiva, of the gums, a little inflamed gums, but that's maybe some spots on the tongue, but nothing very specific.
Yeah, nothing specific, but what it did have an impact was patients didn't go for their annual checkups.
Yeah.
For about a year and a half, and you're really supposed to be on a recall system twice a year, at least, just for cleanings once a year. So we have patients that, like, right before the pandemic hit, they haven't seen us. So it's almost been about 2 years, and they're just coming in now to get their checkups. So that had an effect on their oral health as well.
Yeah. I'm sure those cleanings are taking longer too, to have to take off the plaque from a year and a half to 2 years. So Dr. Kevin, you mentioned gums. September is actually National Gum Care Month. Can you give our audience some tips for preventing gum disease?
Yeah, biggest thing I tell everyone, make sure you're brushing and flossing twice a day, in the morning and at night. And an analogy I love to use for my patients: if you go to bed with your shoes on, that is just like going to bed without brushing your teeth. You know, you go all day, you eat and drink things, you know, have a bunch of different foods, you need to clean your teeth. Just like all day you go running and walking in your shoes, you have to take them off. Same thing with our teeth. We have to clean them.
Flossing's the biggest thing.
Yes.
Can't emphasize that enough.
I'm going to use that one. Use that one about. I'm sorry to interrupt you. I was going to say I'm going to use that one. Dr. Kevin, about the shoes on the feet.
Yes,
Dr. Kyle, what were you saying? I'm sorry.
Yeah, flossing's the biggest thing. Patients just think brushing twice a day is, you know, enough, but flossing is the biggest thing to keep those gums healthy.
Okay. You know, when I was in medical school, there was a dentist who was in medical school because he was going to do oral maxillofacial surgery. And he taught me literally at that age how to properly brush my teeth. And I remember him saying to come up from the gum and then up. And then I think he said to do like circles as well. Is that correct? Or how do you tell people to brush their teeth?
A circular motion. The best thing is the electric toothbrushes because they have that rotary head that actually does the circular motion for you. But if you don't have access to an electric toothbrush and manual, do the circular motion yourself so you could clean around your gingiva, around your gums. Because there's believe it or not, there's plaque and buildup that grows underneath the gums, and that makes them swollen and red, and that's what causes early gum disease, which is a irreversible process. So we got to prevent that.
Do you have any other advice for general dental hygiene?
Visit your dentist twice a year. Once a year, we take annual x-rays to make sure there's no cavities, make sure your gums are healthy, make sure you don't have any pathology going on. We talked about, you know, dental abscesses that could start. All that could be prevented and caught early if you come up for your annual checkups. Because sometimes if you visit your dentist when you're in pain, it's sometimes a little bit too late. And it's you want to kind of do. We stress prevention. It's the biggest.
Yeah, I want to bring up a child, a 12-year-old child, and in 2007, he passed away from a brain infection, and it actually started as a dental abscess. So can you, and apparently he didn't have access to care, had insurance issues, you know, was living in poverty. And unfortunately, you know, we see this in the Black community. Can you talk a little bit or tell the audience like how that can happen, that something as simple as a dental cavity or abscess can lead to death?
Yeah. We like to tell our patients the oral health is connected to your whole body. And once you understand that, you know, with an upper toothache, let's say you have a big infection there and now you start to have that infection lead to your maxillary sinus. So you have the floor of the bottom of your maxillary sinus that's now connected to the bottom roots of your upper teeth. Once the infection travels into there, now it's in the sinus and it just spreads. It spreads like wildfire all the way up to your nose, to your eyes, and then eventually to your brain once it's in the bloodstream.
It's systemic. It's all connected. And you know, certain patients' health issues, diabetes, smoking, that all leads to, and it's a correlation with gum disease. You know, a lot of type 2 diabetics or type 1 diabetic patients have gum disease. Once again, that's interconnected. So everything's really a systemic thing, and it's connected, like my brother was saying, to our whole entire body. And it could start with an infection that you know, in that case, the lack of access to care, that's an extreme case. It doesn't happen a lot. Because, you know, you could at least be placed on antibiotics to prevent that. But, I mean, that's the worst case scenario that can happen.
Yeah. And I see so many young children come into the office with cavities and hollowed out teeth. Just the entire tooth is missing other than the shell. And it just amazes me, you know, the lack of dental care. So the Black community in general, with all these shows that I've been doing, we are ranking at the top always in a way that we don't want to be. Highest in hypertension, highest in diabetes, highest in obesity, everything. I think every show that I've done so far, the numbers for the Black population are the worst. So when it comes to dental care, how does the Black community fare in comparison to the general population?
The biggest thing is education early. And it starts, you know, with Dr. Jobson, who's an amazing pediatric dentist. you want to start, and it starts on the parents. They have to start taking their kids to the dentist early, or just general checkups to visit their pediatrician. But if you educate your child early on the importance of oral health, then when they grow up to become teenagers, adults, they pass that on to their kids. It's like nothing new to them. But I think the lack of education with the oral health in our community is the biggest thing, and it starts with the parenting. That's what we see a lot of times, and a lot of times they'll have issues with their oral health, which trickles down to the kids. You mentioned seeing kids with big cavities, and that's sad to see at an early age.
And like you said, Doc, with the black population having highest numbers in hypertension, diabetes, like Dr. Kyle mentioned earlier, it tends to affect our oral health. So we tend to see specifically, you'll see most tooth loss, most periodontitis is highest among Black and Latinos. Most decayed, usually you see among Black and Latino populations.
Yeah.
So just in hypertension and, like you mentioned, diabetes, it's the same with dentistry, where we're at the top of that list.
Mm-hmm. Yeah. And I think dental decay in general is one of the most common chronic infectious diseases in the United States.
Yes.
Yeah. It's very scary. Why is there such great fear in the Black community? And I'm not sure that this is just the Black community, but I'll ask specifically about the Black community regarding seeing a dentist. And how do you calm or relax and convince people that they'll be okay, that they'll make it through their appointment, that they'll be okay afterwards? Do you promise a pain-free experience, or is that impossible?
Well, it starts with your initial exam. The first visit, the complete exam. It starts with kind of getting to know your patient, and a lot of times it's a previous experience that went south for somehow, some way. They had an experience as a child, we mentioned kid, or even just as an adult, where it might have not gone their way, or they had a painful experience. So now it's being carried over to the next dentist, and then they're telling their friends or their children about the dentist is a scary place to go. But it's there's so many ways to kind of to prevent that. It starts early, but we have ways of using laughing gas, which is a sedation process. Some patients with high anxiety, that you definitely, to do any treatment, you have to put them on laughing gas. And then just being confident with your work, I think. We can't really promise a painful experience, but you can promise, communicate. Are you comfortable, after the anesthesia? Do you feel this before you get started? Does this hurt you? If you feel any more pain, let me know so we can give you more local anesthetic. I think once you open that relationship and, with them at the initial exam, I think it makes their experience a lot better, because everyone has a different perspective of the dentist. I mean, we're always getting, we're scared of you guys, or it's not my favorite place to go, but it changes when they leave. So
yeah. Like Dr. Kyle said, our biggest thing is just make sure you're comfortable. We're pretty easygoing guys. Like I tell everyone, we're normal human beings. We just want to do our job and make this experience as enjoyable for you as it is for me. It's easier for me when you're comfortable, when you're opening and you're not scared. It makes everything go smoother. So our biggest thing is just making sure that you're at ease, we're at ease, and it just helps everything run smoother.
So I was one of those children that had a traumatic experience.
Yeah.
I was younger, and I was very good. I was like always a good girl. I did what I was supposed to do, did my homework, did clean my room, and I brushed my teeth faithfully every morning, every night, and I was good at it. But I never got the back teeth. I just did all the front teeth and the side ones, but the 4 back ones, I got cavities in all 4. And I remember them, I'm sure things have changed, but I remember them stretching this gray rubber kind of a thing in my mouth, and they filled those 4, and I was in so much pain. I cried. I was good, but I cried through the entire thing. And I have been scared ever since to go to the dentist, like literally. And I'm a pediatrician who puts needles in people's arms, but I go, I'm not terrified. And I still take incredibly good care of my teeth. My dentist always tells me, like, I can tell that you floss every day. I can tell you do this, that, and the other, but I still have that little bit of fear every time I sit through the dentist, like maybe this time is going to be the time, that it's going to extremely painful. So,
and you're not the only one.
I know. I hear the children hollering at our health center.
Yeah.
They're going to all the way down the hallway past my door to the dental office. And
that's why Dr. Jobson's so amazing at what she does. I mean, our whole team and our whole staff, we can't be more appreciative than that. But because she sees the kids early, and then when they have all their adult teeth around 13, they come to see us. But she makes the experience so nice for the children in our community.
Yeah, I know her very well as well, and she's an amazing pediatric dentist. So you gentlemen are on the path to greatness. What's next in line for your practice and for both of you personally?
Oh, so for our practice, like my brother was mentioning earlier, so our dad actually teamed up with one of his classmates from school, Dr. Reynoldo Gonzalez, and 2 out of the 4 practices they come together. And that's called now Caring Dental Services. We have Caring Dental Services at La Casita in Little Havana, and then Caring Dental Services at Sunrise. And we're in the process of trying to acquire a third right now in Pompano. So just hopefully just keep spreading the love and try to keep growing our vision of helping the underserved community and treating people with respect. That's our biggest thing. You come to see us, you're going to get treated with respect. You're going to get treated with the utmost care, and by people who are not necessarily looking to make the most money off you, just to treat you right.
And do what's right. For me, what's next is piggybacking off what my brother was saying, is just being kind of a mentor. I think that like one of my favorite age range of patients is from 14 to like 20, because I'm able to relate to them, because we're not that old. We're 28 years old, but we're able to relate to them. And for a lot of our patients and young minority brothers and sisters, seeing African American dentists, knowing that, hey, they could do that too. Because a lot of times it's like, okay, you have a cavity, you have to floss more. That's so minimal, but it's more like, how are your grades? What are you going to do next after you graduate? So it's more touching. If I could touch maybe one patient a day, a young brother or sister, and then hopefully have an impact on his or her life, then that's priceless for me, at least, because they need to see representation in the community. I think that matters, and I think that's what kind of drives certain people to becoming what they want to be.
Yeah, I love to hear that, because that's exactly how and I'm not going to give my age, but I'm a good deal older than you all. And that is exactly what has been so important to me about, and why I love being in the community, is one, that they get to see that, people that look like them can be pediatricians and doctors, and to do that mentorship and give that mentorship. And that's very important to me. And I've done a whole lot of that through the years. A lot of what I've done in the room has nothing to do with medicine, but a lot of it is psychosocial. A lot of it is just advice, on the boyfriend or the girlfriend, or, that type of thing. And it makes it so much more fulfilling for me as a pediatrician. And I can see that it does for you all as well, to be able to do that. So I'm really excited to hear that. And I know you all are doing a great job out there. Neither of you touched on what's next for you both personally.
Personally, I just got engaged a month and a half ago to my amazing fiance. She's also a dentist as well. We met at University of Florida, and she's practicing in Pompano. Sky's the limit. We just, I want a family one day, and it's rewarding and fulfilling, just because her culture is the same. She's Haitian. Both her parents are from Haiti, born and raised in Louisiana. So, she's on board with our mission, and to have a Black female dentist provider, for her to touch the community the way she does is almost like a power team, is kind of the way I look at it. And it's amazing. That's personally my experience.
Yeah.
So ladies, sorry, Dr. Kyle is off the market. Dr. Kevin?
I've been off it. Still available right here.
For me, definitely a little different. Just, right now, focusing on my career. I love my family. I'm extremely family oriented. I'm ready to be Uncle Kev one day. Eventually, hopefully, if God blesses me with a family of my own. But just focusing on work, spending time with my brother, my future sister-in-law, my sister, mother, father, grandma. I like to travel. I'm actually going to DC in a couple hours, so I just like to get out. Yeah, I like to have fun and just enjoy myself.
But it's awesome. It's awesome to work with our family every day. Like I mean, we mentioned earlier how close we are, but our dad being there certain days. My mom still comes to the office. She does like a lot of the insurance stuff. So it truly is like a family atmosphere when you come to the office, and that's what we try to carry on.
Yeah, that's our favorite part. I mean, and obviously, like any business or anybody at work, we sometimes have our moments, but we always say as soon as we walk out the doors, it's my twin brother and my father I'm working with every day. So that in itself is priceless. We can throw whatever small disagreements we have out the window and just keep it going.
That is a blessing. My parents are getting up there in age, and I'm, about 4 hours away from them. And I can't even imagine how awesome it would have been to have worked with my dad, although we're totally different specialties. But that I see it now as an older woman, that is a great blessing to be able to work with each other and with your parents, right? So how do people get in touch if they want to come to see you? How do they get in touch with you? I know you have several offices. You probably have several different phone numbers, but maybe you have a website or a phone number that you want to give out?
Yes. So our website is www.phanord.com. That's P as in Peter, HANORD. Our main office is 305-685-7863. If you call that number, we're open Monday through Thursday, 9 to 5, and then Fridays from 8 to 1. From there, we can redirect you to any of the other locations, but that's the main location.
Also, too, social media. Our handle's Phanord Dental. So you could always, because everyone's on social media, especially I would say not the younger population, but TikTok, social media, the handle's Phanord Dental.
Yeah.
So you could reach us there too. And message for appointments or anything like that.
Yeah, personally, our Instagrams mine is Kev_DMD, and you are
KJP.DMD, and we have a TikTok too as well.
Dentist Duo, yes.
Yeah.
I tried to look it up. I couldn't find it, so I'm gonna have to try that again. I'm not good with social media, but
we have an amazing team. Shout out to Sunshine Communications, Miss Bernadette Morris and her team. The ladies are amazing. Yes. Also, what she does for the community is awesome. I mean,
I know her. She is amazing.
Yeah, she's amazing. Yes.
Yeah. Okay. Look. Yep. She's known us. She's known my dad and us pretty much forever. So I mean, it's full circle to work with everyone. The community is really small when you really look at it, especially the minority community.
So what insurance do you accept?
Oh yeah,
heavy.
We accept most insurances. I really encourage all patients. If you call and ask, we more than likely accept your insurance. If not, do not let that stop you. We still have certain payment plans. We have certain plans and structure where we can help make it affordable for you. I always tell patients, my main concern is to help get you out of pain, help treat you properly, and then from there moving forward, we can discuss the finances and come up with a plan together. But either way, we'll see you.
Yeah, if you come into the door, like he was saying, you're gonna be treated as a person, not a number. Like we're gonna do what's right.
And what all do you all do, or maybe just some of the things that you do? Because some dentists don't do, and I don't know the fancy word. So give me a rundown of what you all
do. It all from as simple as a filling to as complex as needing an implant, to making you a denture that comes in and out, to having a denture that gets screwed on with implants.
Cosmetic, we do veneers, crowns, root canals. I mean, we
pretty much in-house specialists. We have the best pediatric dentist in South Florida, Dr. Margot Jobson. She's been with us over 20 years.
We have an orthodontist in the office, an oral surgeon in the office. Yes. So we want to be like the office that's a one-stop shop. You come here, like any service that you might need, that might be a specialty service. If you want braces, we have that. If you need a wisdom tooth pulled with our oral surgeon, we have that. Like he was saying, we do implants, we do cosmetic cases. So
it sounds like you do just about everything, and you accept most insurances, even those without insurance.
Yes.
Give the phone number one more time, please.
305. Yes, 305-685-7863.
Okay. All right. So that brings us to the end of our show. Dr. Kyle, Dr. Kevin, thank you so much for coming on today. It's been a true blessing to the community. I can see that you all are both a true blessing from the community. I've known you both since you were 8, 9 years old, somewhere in there, and you have always stood out. So I am not at all surprised. I knew that you all were headed to do amazing things. I'm glad to see you come back to the Miami community. I'm glad to see you in our community and giving back and remaining humble and as beautiful and intelligent and wonderful as you young men have always been. So I'm super proud as your previous pediatrician and second or maybe third, fourth or fifth mama and continue to do the great work that you do. Any final quick parting words for the audience before we head out?
Thank you for having us. It's an honor, really.
Thank you so much. We really appreciate the platform. Just come see us, guys, and we'll take care of you.
Yeah.
Awesome. And just a quick word to our sponsors. Thank you. Black Health is brought to you by FAMU Medical Marijuana Education and Research Institute. Get credible information and engage in a safe space to learn and talk about cannabis. Educate, learn, and talk about cannabis in Florida. FAMU Medical Marijuana Education and Research Institute. Thank you, everybody, for joining us today. It's been a wonderful time. And we will see you next time on Black Health. Dr. Kevin, Dr. Kyle, wonderful to see you all again. And thank you again.
All right.
Bye, everybody.
Bye. All right.